first of all, I'd like to ask your permission, both of you, to use this video for educational purpose and on internet.
Yes, doctor.
Now, first of all, tell me about your symptoms before the surgery.
Bad back pain, sometimes very bad. Could only walk about 100 yards, and as I walked, it would progress and get real bad. Numbness and pain in my right foot, toes and ball of the foot, which would also progress.
Well described, almost as I trained you to say that. But 1 to 10, how bad was the pain?
Well, it would range. At the end, I wasn't getting any relief. Even in bed, it would be 2 or 3, but walking around, like if I parked in the handicap spot, walked around the grocery store, by the time I got out, I was in the 7, 8, 9 range, but I was hanging on the cart.
Yeah, and that is actually the typical way people do when they have back pain. They learn to bend over so they open up the space for the nerve to have more space. Now, let's specifically talk about your leg symptoms. Where was it?
It was in the ball of my right foot, in here on my right foot, and in my toes.
In the toes?
Primarily the big toe and the 2 next to it.
Okay, that is practically L5 and S1, we call them. On both sides or where?
Mostly this one. I had some numbness on the left, but it would be 70-75%.
Okay, how is that now?
It's better, but I won't be able to know until I walk 100 yards for sure.
Yeah. So how far have you gone so far?
I went all the way down to the end of the highway,
hallway. So far you haven't noticed that yet?
No.
Good. No, the surgery was just yesterday. We did your surgery in 46 minutes and we just looked it up together, the data of the surgery. You lost 16 cc of blood, about half an ounce of blood, which is really nothing for surgery like that. Now, when did you start walking?
Probably 2 to 3 hours after
the surgery. Yeah. That is the typical time for my patient to walk.
That was just to the door and back.
Yeah.
But then as the night went on,
Now, there's another important thing about you. You're not. We are here in Hutchinson, Kansas, but you're not from here, right?
We're from the suburbs of Illinois, western suburbs.
So you're coming.
Chicago.
Chicago. So why are you coming so far to come to Hutchinson?
Well, this has been going on for a long time. I had first had a laminectomy in 2019. Looked into fusion because the doctor wanted to do it and decided I didn't want to do that. So put it off. But then when the pain accelerated, I saw some other doctors, and I ran into you. You were a guest on a show on the internet, and I went, wait a minute, this guy knows what he's talking about. So I watched a few hundred of your videos,
wow.
at least.
So few hundreds.
A few hundred. Well, I just had it. It's right there. It's on right now.
Yeah. Well, actually, good. That's a good number to watch. Did they help you? Did those video help you?
Oh, absolutely.
Well, how did they help you? Tell me.
It helped me to understand my expectations and to keep them real. I watched your charts about not being 25 or 30 again and meeting the old chart.
That's called the natural history of spine. If anybody's interested, it's called a natural history of spine. And and I remember when you and I met yesterday in person for the first time, right?
Yes.
Because the rest of the meeting was online.
Zoom calls,
Yeah, and that you're one of my best informed patients, and I know it makes sense. You got most of the information already, and your question was very on about the procedure and so on. So you were very well informed, and I love those patients.
Yeah.
One other important thing is I'd seen 2 surgeons in the Chicago area. One was talking about an S1 to T10 fusion. Another one was talking about a 3-space fusion, or 3-disc fusion.
Yeah.
And then we talked about it, and you cleared it up, and everything made sense. And I'd rather do less than more. And live to fight again another day.
So we did a 2-level fusion because, based on your symptoms and films, that's not the only problem that you have.
Right.
But those are what's causing your current symptoms.
Right.
And I'm a big advocate of fixing future problems in the future, not preemptively doing a T to S1 fusion where you have to recover from for a very, very long time. So.
And then the conventional, where they massacre your muscles, as you say.
And we've known of too many people who have had repeat surgeries with conventional, and it just never ever gets better.
If you go onto my webpage, you will see what they say, what the complication rate of those traditional surgeries are.
Oh, sure.
For that surgery, T to S1, do you want to guess what's the rate of infection and other
I think
complications?
it was like 15%.
Yeah, 15% is just the rate of infection. Rate of other complications is even higher. Well, in comparison, the rate of infection for our surgery is 0.2%.
Yeah.
Not a single take back to surgery after 1,500 cases. So I think that this information, as you prove it, is available for the patient. So that is the best recommendation for anybody else. Go on the internet, research your problem, and get information.
And I
So
searched
thank you.
3 things: Inspired Spine, OLLIF, and Hamid Abbasi.
Yeah,
I
well-
searched all 3. Maybe I'm missing one, but that
No, you
really,
did just fine.
yeah.
Well, thank you so much for
Oh,
the
thank
interview.
you,
I really
Doctor.
appreciate
Thank you
that,
so much.
okay? Thank you.
Thank you.
Well, thank you.